you guys, because I want you to know that if you are, for whatever reason, bumped out, you'll be able to watch this on YouTube later. So if you get pulled away or you lose your internet, this will still be available on the library's YouTube page. Just go to gcpld.org and at the bottom, click on our YouTube link, and you'll find all of our Business and Breakfast recordings. So in terms of what you're seeing, you should have a chat button and a Q&A button, either at the bottom or at the top of your screen. The chat is open to everyone. We're hoping that you'll, comment on what we're talking about, speak to each other, share links and your own advice to each other. You'll want to do this by first going to the bottom of the chat screen. There should be a 2 and then a blue box. Right now it's probably set to all panelists. We'll change that to all panelists and attendees. Now, if you want to speak with me directly, you can change that to just all panelists. Otherwise, go ahead and keep it on all panelists and attendees, and I'll shoot reminders out just in case you wanted to speak with everyone and not just us. We are going to be taking questions. That's going to be the majority of this, though Josh will be giving some a general introduction. I would really appreciate it if you use the Q&A for your questions. That just makes it a lot easier for me instead of trying to keep track of the chat, to just have questions all in one place. And we'll make sure to, you can just start putting them in now, and we will get to those soon. And so that should be it. If you have any questions, just throw them in the chat directly at me. If you have any issues, I can probably help you with those as well. Just a quick housekeeping for the library. So right now we are planning very limited in-person services starting May 11th. That will, at this point, that looks like you can come in to pick up a hold. We can page books for you that are in the library itself. If you have something you need to fax, you can come on in and give us the papers. If you can wirelessly print to our printers, and then we'll take care of that for you. We won't really be accepting money, but we will make sure with the books that you want, the DVDs that you want, and that you'll be able to return things soon. So keep an eye on our website for more information about that. All right, so with that, I'm going to go ahead and hand this over to Josh.
Thank you and good morning. My name is Joshua Williams. I'm with the Garfield County Public Health. My regular duties work as environmental health manager. So some programs I have underneath me for that are air quality, water quality, on-site wastewater treatment systems. Most familiar with some of you probably is the restaurant, retail food establishment licensing inspection program, as well as radon, some other outreach programs. So during this, I also help manage the emergency response program and our functions under emergency support function 8 for our healthcare and emergency support response. During this event, I've served mostly as logistics chief and working with the operations to answer questions around businesses and restaurants as we've went through these multiple order changes. So I appreciate being invited here today to look at the Garfield County's roadmap, and to that goes along with the governor's movement from the stay-at-home order to safer at home. So what we have strived to do once we got notification April 20th that the state was going to move from the stay-at-home to a safer-at-home approach, we began looking at putting together a local plan towards meeting these goals and providing guidance to our citizens to go through these phases as we move from the stay-at-home to safer-at-home. I think one thing with Garfield County that was already in place, we work closely with local businesses during the stay-at-home order, and many of them are already aligned with this first phase of opening, and we're not expecting to see a significant change for some of them. While obviously there's for some it's going to be moving from possible no operation to expanding back to curbside delivery, or being open to having some folks into their businesses with retail and some personal services. So we worked with our restaurants around changes to the takeout and delivery, and we've seen some of them be quite successful in that. One thing with the restaurants is they're going to continue underneath the governor's public health order 20-28. Restaurants, taverns, and bars and venues will remain in their current just takeout and delivery through May 26th. So that's one that is staying in its current form and not changing, but we've worked with many of those to get their takeout and delivery into a robust format, as well as we understand that some have just decided to stay closed fully during this and may remain that way. We worked with construction companies around continuing projects safely. We didn't shut those down, and those will remain as a critical function, and as well as not have to comply with some of the size restrictions that some of what they're terming more non-critical businesses have to. We've also worked with some small businesses around curbside and delivery already, and are making that helping make that transition with new ones that are coming online. Some were childcare facilities. We've really worked hard with them around what restrictions and abilities they had for opening during this stay-at-home time as we transition to safer at home. We've also worked with auto dealers as well as golf courses, as just to point out a few that we've had some close relationships with during the stay-at-home. But we're looking at the safer at home. You've probably heard with some transition on the 27th. The stay-at-home order expired on the 26th. And so as we moved into the beginning of this week, what has changed for Garfield County is that real estate and showings could occur, as well as curbside services for retail could begin. But our plan is looking at May 4th as the target date for looking at the personal services category, that being hair salons and massage therapists, some elective surgeries as well as dental. And so beginning in that phase to look at getting them with some reestablished operations. So what I'm going to share a screen here, excuse me, that mainly looks at how to access the information around the roadmap and the form that we're asking folks to fill out. So if you go to the Garfield County main page, we've tried to create it so it's garfield-county.com. At the top of the page, there is a button. There's COVID symptoms testing data. If you want to learn more about those issues, as well as a place for business and unemployment, for resources for financial support, as well. What we're looking at is a safer at home button. So the safer at home brings you to a page that has the orders listed and some of that discussion. It also has a link to the state's safer at home page, which has some great information for individualized business niche categories. that you can find some resources. Our main topic today is looking at the Garfield County roadmap, as well as the social distancing plan that businesses are being asked to fill out and submit during this process. So that button takes you to the Safer at Home page. And this main entry point here has a link to the social distancing plan, as well as if you have questions, immediate questions, you can access this page and fill out this form, and it will submit a question directly to our public health info line, and we route that to one of our category experts that we've had listed under operations in our operations branches, and they can work with you with any direct questions that you have with this process. But the business social distancing plan link is on this page, and to fill it out, we've tried to make it as user-friendly as possible, as well as keep a streamlined process that looks at having an online portal to where you can enter your business name. We're asking for an email so we can have email correspondence with you. But it goes through, and it's mainly a checklist that follows along what the requirements are for your business to be open during the Safer at Home time period. And most of those are around following the OSHA guidance on preparing workplaces for COVID-19, because most of it with employers is how you're protecting your employees during this time from disease transmission, as well as that employee and public interface scenario. So I'm just going to scroll down and just take a quick glance. And like I say, most of it is a checklist type scenario that goes through. So you can really, the point is to have you get familiar with this, what the requirements are, have you read those requirements, indicate that you've read them by checking, as well as looking at describing what measures you've put into place, so we can have that understanding of what your processes are. So it also looks at the social distancing piece of keeping 6 feet apart, how you're preventing crowds over 10 from gathering, or, since the guidance is 10 or less, or below 10, then part of it is how you're controlling that number of folks within your establishments, or conducting with your services. Looking at how you're doing sanitizing and disinfecting in your business locations. And so I just wanted to quickly just show you that the submit form at the bottom directly submits it into our consumer protection email. And so we retain a copy of what you submitted. And once you submit it, there should be a page that pops up that says you filled out the form. It basically gives you kind of a certificate that says that you filled out Garfield County's business social distancing form. One thing I'd like to point out, though, if you want to retain a copy of what you've filled out, you'll need to print a screen before you submit it. I understand what they told me from IT. We put this together in a couple days, and so I think we've done a pretty good, robust job of giving it into an online format. But you will have to print the screen if you want a copy of what you have submitted. You also can go to this link here, which is publichealthinfo@garfieldcounty.com. This link will get you an email directly into our system. If you have any questions, you maybe hit submit and didn't get a copy, we would then have your email. We could work with you to try to get you either guidance documents or any questions you have or concerns with the process. So once you hit the submit form, that comes into our offices and we have it on file for you. And so that's really what the process is. We're looking to have these business plans, social distancing plans on file, and we're going to be looking at them as much as possible. But really, you know, with the situation being the way it is, our main goal with this is to give a support document for the businesses to fill out, to go through, to look at what requirements they need to meet for operations, opening back some of these operations. And we're keeping it on file. And if complaints come in, then we'll be doing investigations around that. And the first place we'll look is the business file the proper documents with the social distancing form. And we'll be looking for any issues that we might see with the form. But that's kind of the process we're looking at. Going to the link to the plan on the page pulls up the roadmap, and we've tried to embed links directly into the plan that you can pull up. And if you want to fill it out manually, that same document is at the end of this plan and can be filled out and then submitted, and the instructions for submitting it manually via email to the consumer protection at garfield-county.com, or you can fax it into our fax line 970-625-4804, or via mail to our Rifle location at 195 West 14th Street, Building A in Rifle. We also have a phone line directly to our Rifle office, which is 970-625-5200 and extension 120. That routes you to Maria. She is also bilingual and does our Spanish translation for us. So if you have any questions, you want a phone conversation on those, that's the number that you should start with. If it gets to Maria, then what she does is triage the calls. And if it's specific to a restaurant or a certain business category, then she'll route it to the staff that are working in that area, and then they will get back to you to discuss your questions and help guide you through the document. So the link to the OSHA guidance document, which is really important to review during this process, is embedded in this document, as well as guidance from the CDC on building and disinfection, and that includes hard surfaces and soft surfaces that will guide you through the process. The OSHA document breaks it down into your business into exposure risk categories, and those exposure risk categories are based on the transmission of COVID, and a lot of it deals with whether you're working with known COVID patients, like such as in the healthcare setting, and as well as probable cases, and then the unknown, which we're still in with the community transmission that levels. So that's what the categories are based on, and how you should evaluate your business, as well as the guidance that goes along with it to look at how you fill out your form and develop your plans. So some things that we've had that gave us guidance around this roadmap, we've worked with the Colorado Association of Local Public Health Officials, as well as Eagle County, what they're developing, and Mesa County as well. So we've tried to work together to have some consistency, since a lot of businesses work across territorial and jurisdictional lines. We understand this, but we decided to go with the CalFO document as the main guidance document, and on how we're approaching the criteria and trigger points of what we're looking at to be able to slowly reestablish some economic activity, knowing that we're still in a very sensitive time period of potential disease spread that could lead us to a point of having a second wave or another surge on the hospital's healthcare system. So that's part of what our job through this is public health, is to monitor the situation and look at what our testing results are coming in, as well as what our hospital capacity is. I think the main goal for us is to carefully watch, work with the hospitals as we have been doing, monitoring their personal protective equipment supplies, as well as what's the impact on the local healthcare system if cases start to increase with this reopening phase. So the main things that we're looking at and are outlined in the Public Health Order 20-28, the Safer at Home, for the businesses to minimize disease transmission, is we're asking that someone in the workplace be designated as a coordinator that's charged with addressing the COVID-19 issues. Really someone who can be in charge and take lead, and like a safety officer that can continually analyze your situation and your daily operations and call out issues of safety that might be there, or points of issue around not maintaining the social distancing protocols. And so the maintaining the 6-foot separation between employees, that's between the employees themselves, is a big part of it, as well as discouraging shared spaces. So not having those collective areas of break rooms, or where you would have congregation or folks congregating, as well as maintaining those distances between employees and the public as much as possible. Obviously, we understand that some of these require that 6 feet between the employee and the person getting the services is not being able to be maintained. So that's why there's guidance around the mask or face coverings. So part of that is clean and disinfecting all high touch areas regularly, several times a day. Sometimes it may have to be between each customer, depending on what the service being provided is. Posting clear signage for both employees as well as customers on good hygiene and proper hand washing. And if folks are in need of signage, we have a pretty robust collection of signage available to us because we do the restaurant inspections. And a lot of that is education. And so a lot of those forms we have developed and can make available, as well as available through our websites. Part of the plan, your plan needs to be looking at your ventilation and ensuring proper ventilation. So if if it's a newer air exchange system, those need to be set to maximize fresh air exchanges. If there's windows that can be opened, that's part of what you need to evaluate for your own business on how you can increase your fresh air or outside air ventilation in a safe manner. So the thought being around that is the greater the ventilation, the more air circulation, the less that opportunity for the virus to hang around on any air particles, as it, the part of that 6 foot ties into its ability that they're looking at for some airborne transmission, as well as the separate from the surface transmission. So avoid gatherings. So look at your meeting rooms, no conference rooms with gatherings of folks. Your waiting rooms need to be evaluated to how you're going to meet those social distancing guidelines, as well as no more than 10 people. You need to implement a symptom monitoring program for your employees. So that's going to look at conducting monitoring your symptoms, any COVID-19 symptoms in your employees. We have a sample form that is within this document that you can access for that. Let me scroll down, which is basically kind of just a log of checking your staff on a daily basis as they come into work, asking them appropriate questions, and looking at that employee illness policy and how that goes along with it. So we have that sample form available for you. And then if there is an employee that shows symptoms, we're asking you to send that employee home immediately, increase your cleaning protocols in your facility, obviously hit that social distancing, those social distancing requirements again, and exclude the employee from work until they are fever-free without medication for 72 hours and 7 days have passed since their first symptoms. And if you're starting to see multiple employees, then direct contact the local health department as soon immediately is what we're asking with the protocol. The sooner that we could get on a potential outbreak scenario, the sooner that we can do the contact tracing and figure out where it started and who the employees have been in contact with, as well as get notification out to any customers who might have been in your facility during the time period that were possibly able to transmit the infection. So those are just a couple highlights with that. The symptoms tracker is within this roadmap plan. We have the form, or if you want to do it by hand and submit it through those other methods, as well as scanning it and even emailing it. There's also signage templates that are in here too. So real quick, part of the roadmap, we have lined out what phase 1, phase 2, and phase 3 looks like. Phase 1, we're looking at lining up with the governor's public health order, except for the date being the 4th of May as opposed to the 27th for some of the businesses. We're really looking at that 4th date, so you have the opportunity to review this information as well as the support documents and the cleaning guidelines, have the opportunity to ask some questions on when you're putting your own plan together, and that's part of and getting this plan submitted to the health department, so you can get verification that you are following those protocols and have that on file with us, so we can answer any questions from the public that come in around that. So it's broken up into several different categories on what you need to look at as part of will be in place for your business to maintain in their plan and operations. And then it also breaks down some discussion of what critical businesses are under, as well as some different categories of businesses. We didn't get everything in here, so that's why some folks may still need to reach out to us for clarification or seeking guidance for their exact business type. We tried to cover some that are more generally based categories. And so we also have some guidance documents that are within the public health order from the state, 20-28, and it has appendices that list what the critical businesses are, their definition, and that is similar to what was in place with the stay at home, and as well as looking at personal services that are now coming online, and some individual discussion of business categories within that. So so that's the roadmap document. And let's see, there's a golf course guidance. That's been a big topic for us. As well as a example sign that you should post in your establishment. We've provided a template that you can use, so you're not having to create that if you're not computer whiz, and I'm not. So I know sometimes formatting and making signs is difficult, so we can try to get as many of those for you as possible. The online form is our preferred method. We do have ask again that you put an email in there, and so we can email you if there's any questions we have about the plan. But there's also at the bottom, of course, you can always put your phone number, and we can have a direct interface with you there. So looking at those dates again, May 4th is our main one. That lines up also with the reestablishment of the ability to have 50% of your workforce in person. We're asking that, I think, through this, if you have the ability to continue telecommuting or remote working for some, look at analyzing that as part of your plan, keeping that in place as long as possible. We understand for some businesses, it's easier for them than others, but that is an ask. But it does allow for larger workplaces to look at that 50% of in-person workforce being established on that May 4th date as well. Again, restaurants, bars, that category that was first shut down as far as venues and gatherings, those are still under the public health order to remain either closed, or with restaurants, the curbside and delivery takeout scenario. And I believe that the alcohol scenario is still the same. That's not regulated as closely underneath us with the liquor board and things. But I do believe that those are still being in place for takeout, or carry out with those parameters as well. So that is kind of a down and dirty, I guess, overview of that plan. I wanted to just kind of highlight that and go through that, so we could look at how that's laid out, and as well as the form. So that's mainly kind of what I wanted to hit, so we can get that in front of everybody. And I'm happy to take questions moving forward.
All right, so just a reminder, if you have a question, go ahead and click on the Q&A box and type it in there. It just makes it a lot easier for me. We won't be turning on folks' audio so that they can ask them that way. But we have 4 questions already. First of all, we have Susie with Ascendigo Autism Services. They're a residential 24-hour care program for adults. They've been keeping their clients separate from each other, hoping to be able to slowly start getting them together outside only for companionship during exercise, as isolation fatigue is hitting them hard. Is this in line with public health guidelines for our unique residential care program?
Yeah, I think, looking at facilities who have residents, the gathering, the number piece that was in place before, as it moves into this next phase, is that 10 or less number. I think we'll probably would look at having, look at the ability to, with face masks or face coverings, and that's a piece that goes along with the businesses that are opening up and their employees having to have face coverings, and in scenarios where they can't maintain the 6-foot distances and have to have that close public interface. And so I think looking at those protocols, if those can be maintained, I think then that you feel comfortable that the social distancing guidelines can be met, then, and it's an outdoor, that setting, I believe that is in line with what we're moving into with this next phase. And I think it really, it kind of, what we're trying to look at is, it really goes back onto each individual business or situation to really analyze these documents that we're trying to provide, as well as the OSHA and the social distancing guidance, the being able to meet those parameters. If you're able to do that, and having a solid plan of approach, I think is a big piece of it too. So if what we're seeing and what we did kind of see with the construction phase in the stay at home is, other people are out, are looking, and they don't hesitate to call the health department. And if they see a gathering of folks or whatever, and we do take complaints. So I think if you have a solid plan, and that's defending, being a good defense of what your operations are and how you're approaching it, following the guidelines that have been provided, then that helps us both work through any situation to where there would be a case. The most unfortunate situation would be where there would be an outbreak or something within the facility, or that would involve your business. So the better you can be prepared to answer questions and have that plan available for us to work through, to see that you did your best and due diligence in approaching this, then I think that's the point. And so it does look at opening up those gatherings to 10 or less outside, and I think that would line up with that. And again, if you have a situation where you want a closer analysis of your plan or a closer discussion, we're available, and that's what we're striving to do, I think, through this, more than looking exactly, going through. We're trying to have our staff available as much as possible to have that direct interface if that's what's needed through this process as well. So don't hesitate to have a direct interface, and we can look at your plan or any other a situation that might be unique, like the Ascendigo. I know one thing we've had discussion about as a broader public health community is camps. And we have a lot of camps in our community, and I don't think those are going to be opened up for the overnight scenarios, and this is still in some development. So it's always subject to change, but I feel like we need to talk about it as early as we can, because if we're looking at the camps from a scenario of, if it's a day camp and it follows the child care guidelines that are available and it's a similar situation, then that's, I believe, one issue. If it's local folks and the travel restrictions are still going to be on for remaining local travel and not having tourism open back up, and national travel and even interstate travel or intercounty as less as possible, unless it's business critical. But so general travel will still be restricted, and looking at those overnight camps, I think that's one place that probably won't be open back up. But we're trying to look at it from the child care standpoint. If it's a day camp and meets those scenarios, then that might be someplace that opens up during phase 2. But I can't promise that. I'm just saying we're trying to analyze those situations. So, I've got a couple screens going too, so I keep looking back and forth, so I apologize. But
no worries. Christy asks, if we're not going to reopen our office with 3 staff until June 1st, should we wait to fill this out until closer to the end of May? How far in advance do we need to submit this?
Sure, and we understand, and we've gotten quite a bit of feedback that some businesses are going to keep their offices closed or remain closed, and that's the part of this, and it's your place to make that decision, and we will help with that as much as possible as well. You could, I think the earlier you submit it, the better, but it's not really got the time restrictions. We're asking for those looking at opening May 4th to have it in by then and on file with us. But if you're not planning on opening until a later date, then it wouldn't need to be on file with us and submitted until before you're ready to open. And I'd say, you know, kind of like with this scenario, we're trying to get it the week ahead, as and we'd probably ask the same kind of time scenario for that.
Great. Carolyn asks, how do we as a community monitor the success of the Safer at Home program / economy reopening and watch for any potential spike in cases? Is a business required to report a suspected case of COVID to the health department, be it an employee or a guest? What is the testing protocol in this situation?
Those are good questions. So what part of our function under public health is to do some of that monitoring. We also have our data page on our Garfield County website that you can access, and we're trying to keep that up to date, as well as have graphs that go along with that, so you can look at the cases load, have we went through time and where we're currently at. You know, I think if you have a suspect case, you know, the earlier and quicker you can get that reported to the health department, I think is what the ask would be. It may be just working with that person to get them into isolation or quarantine procedures, and then we need to look at potential exposures. Right now, the testing protocol remains the same as it was before. The testing is done through the hospitals, as well as I think there's one other provider in Glenwood Springs. We're working with Mountain Family to look at testing abilities through there too. But the testing, we're really looking at how, working with our hospitals, how we can expand that. You've heard some, I think you've probably heard some with the surrounding counties, Eagle and Pitkin, as they've worked on some different testing protocols. I have to say that, you know, we're working with our hospitals on similar newer available testing. The hospitals are working on some expanded testing equipment and things that we've got but they also are taking an approach to verify that testing, make sure it's accurate and is quality testing. So those are still the same. The person would have to enter into the medical community, into a medical facility, and then get the testing from there. So, but the quicker that we can get contact on that, I think with the health department and analyze the situation and monitor it, look at contact tracing, the better. So.
This one, I think I can answer. How can we get access to the PowerPoint to share with colleagues?
Okay.
Just so you know, this is being live streamed right now on the library's YouTube page. So you can actually just have them go to the library's YouTube page. You can search for Garfield County Libraries on YouTube, or go to gcpld.org, and you'll see at the very bottom of the screen the link. And I'll be plugging in these links that I've put in the chat, sort of commenting on them with the library YouTube page. That should be available by the end of the day. It's actually pretty quickly processed and put up.
Yeah, and I can make sure and email you some of these links afterwards as well. You can add to that if that's the best way to go about it. Then it can have some direct links that you can plug into your website and have that available too. But I can work with you on that. We can figure out what's the best way to move on forward on that too. So thank you.
And you can throw your email address, just send that to the panelists, and we'll make sure to get that information to you. The next question, do essential businesses that have been operating during stay-at-home need to complete a social distancing plan to be compliant with the new phase?
Yeah, I think the approach that we've taken is to try to keep it as simple and streamlined as possible. So we're asking that all businesses submit this plan, and then so even if you've been open, to go through this scenario, it'll be a good refresher on looking at what is the protocols that need to be in place for all of us. as we move forward into phase one. And so, yes, we're asking for that.
Great. Laura asks, I work in a professional office. If a person comes to the office without a face covering, can we refuse entry since we do not have extra face coverings?
Yeah, I mean, we've really been looking at this from if your guys's, you can put together what protocol you feel is best for your business. And if that is a situation to where you're asking your customers to wear face coverings that similar to what your employees, would be mandated to wear, then, I think that is fully within your ability to restrict or mandate what your customers do on your own property. And because we understand that one thing that we've had discussion with this, with the, through this scenario, and especially myself as logistics and helping to try to manage the personal protective equipment, we're still under shortage with the personal protective equipment. And I've tried to message that going through this is, so that's why those hospitals and the patient load has to be carefully monitored. If there's a surge that could potentially eat up what PPE we do have on hand, as well as even with the elective surgeries or dental practices that require PPE, if they don't have those, then they don't move forward with opening. As well as if a business can't meet these mandates of looking at what they need in place to have for the social distancing plan, as well as the clean disinfectant protocols and the employee safety piece, then decisions have to be made around. Then it might be a scenario to where it can't. We have to have those supplies on hand. So I know I've gotten some feedback from some already that gloves are hard to access in the free market, and as well as masks. N95s have been, with the medical community, have been the greatest difficulty. We have seen some supply chains open back up with some of the surgical type masks, gloves, but those distributors and regular supply chains that may have been there we're still seeing difficulty in reports back that there's difficulty acquiring that. So that's going to be a piece that we have to continue to work through.
Jeremy asks, do brick and mortar businesses only have to submit? What about contractors with no public spaces or offices?
Yeah, so we're asking that all types, sole proprietors, contractors, and that if you're going to be working in the community and have your business reopening under the safer at home phase, then we're asking everyone owners, sole proprietors, contractors, to fill out this form.
Right. Any idea when lodging, hotels, and campgrounds will be allowed to reopen?
The public health order from the state, 20-28, it right now goes through May 26th. And, I know there's looking at phase two and some of these larger, increasing that crowd size from say 10 to 25 or what the next step is. I haven't heard, as far as the county, Garfield County, hotels, lodging is still open. As far as if it's a municipality that, I believe Glenwood Springs being one that had some different requirements as they've instituted their local protocols around their health powers, then that would have to be directed towards that municipality for answering that. But as far as Garfield County, outside of any municipality that may have taken its own course, then those hotels, lodging. I'm not sure about campgrounds, as there's some difference between what the feds control, the federal government controls with BLM and Forest Service land. I doubt that those are going to be open back up. That I haven't heard of anything anytime soon, but private campgrounds would be another kind of separate from that. And I believe that we're working with them, separate from what may be going on with the Forest Service and other like state-run campgrounds. But just to reiterate that throughout the majority of the county and from Garfield County Public Health and the Garfield County Commissioner's standpoint with this roadmap is hotels and lodging hasn't been restricted. We have sent them guidance, as well as they have specific guidance on what their room turnaround looks like. They're supposed to obviously have the cleaning and disinfecting protocols that are COVID-19 level, using the products that are COVID-19 approved, as well as 24 hours. Their rooms are supposed to sit 24 hours between reletting those rooms.
Income travel is limited, and phase 2 states limited. Do you have more clarification on what that means?
Well, I think, during this first phase, and along with what the public health order from the state is on travel, is strictly limited to residents within their own jurisdictions, travel for work, essential necessary functions, critical businesses and government functions. We know that folks in this geographic area work across county lines, and we understand that. But we also, that's tied to the business operations that are being opened back up in a limited fashion with these restrictions. And what we've tried to sync up as much as possible with surrounding counties is that, as well as with the state order, those parameters and restrictions would be the same, and it's mostly business related. So the tourism and travel stuff is still heavily restricted with this first phase. We'll see. I think we have to look at what the state is going in the direction that they move into their next phase at this date of May 26th. So we'll kind of have to wait, and it'll probably be a similar scenario to this one, a week before they come out with answers from the governor's office, and then the public health, Colorado Public Health and Environment has to work to get an order around what that information is, and then we have to do the same in a reaction to that. So we see a scenario to where we really get the information and are asking for that to be changed at the state to where we can be ahead of it also, but we've had to kind of react ourselves to some of this information. But we've also have strive to get that turned around as quickly as possible so we can get guidelines to our local citizens. But if it gets opened up, I can't predict what the governor is going to do, or the state, but I would say that travel restrictions are going to remain in place at least through this phase and possibly into the next phase.
I have a couple of facial covering questions. Laura asks, if the requirement is at the state level, but the local mandate is removed, which do we adhere to? As well as when that May 1st requirement expires, will customers, employees of a salon still be required to wear a face covering?
Okay, I'll try to answer that. I think, what our restrictions are as the type of county that we are, is we have to minimally meet what the state order says. We can be more restrictive. We can put more restrictions in place, like we can have the date May 4th versus May 1st or April 27th in that scenario. But we can't be less restrictive. So The guidance around the face coverings is it is required, and I believe that the language reads that if you can't meet those social distancing guidelines, and then it has to be done. The restaurant, there is a specific order that covers face masks and for restaurant employees and in that situation. So there's a couple different guidance documents, and we can always have that available. But right now, I think if you approach it from the standpoint that employees need face coverings in looking at tight quarters and not being able to maintain social distancing as well as close interaction with them, the public, or if you have a personal services category, then those are still mandated. I would, that's through May 26th, and I would expect that to probably stay in place moving forward. But we don't know after that May 26th date. But for right now, that's at least through this next month. My phone's blowing up, so I apologize. I've got some of my staff are hitting me up, so.
No worries. I'm still waiting for my dog to start barking at something. Larry asked, my business is completely virtual using Zoom and telephone. Do I need to submit a form?
We would like you to, if we're asking, I'd say yes, and we understand that some are not opening to the business, but if we're looking to have as much on file as possible, as for not only our information, if there's questions that are asked, but so we can analyze what is going on in the community. And so if you can and will, that would be great, because that's, kind of the ask is we're just asking everybody that, regardless, and then that way you don't have to get into some of these businesses don't, some of these don't, others don't. And so, because that's been really confusing throughout some of this change process. So we're trying to keep it open that everybody needs to go through this process. And it may just be putting in there that you are work from home or a telecommuting, and you aren't open to the public, and that may be your response. So, but if you do telecommute, you have, say, employees that you meet with on a regular basis, that is a scenario that we're trying to understand. So.
Awesome. All right, and last question here. Courtney asks, will government offices, specifically the DMV, be open?
So yeah, Garfield County government, I can speak to that, is currently working on its own reopening plan. We spent some time yesterday working on it. The risk manager has been working with the county management feverishly to get those protocols in place so they can get those services reestablished as soon as possible. I don't have a drop dead date in front of me right now. I would think that it's probably sometime after the 4th, as we move forward into this phase 1. And I expect that to be widely announced when that occurs. I could see that being one of the priority areas with the clerk and recorder's office and the duties they have with the licensing, license plates and those type of renewals or registrations being categorized an area. As far as the state offices, I can't speak to that because I haven't heard any information on that.
All right, any last questions before we wrap up? Give folks a moment to type. So just a reminder that we've been live streaming this program here. So it is on the library's YouTube page. Like I said, it should be available within a couple hours. And then by the end of the day, I should have all the links to Garfield County, garfield-county.com and the various documents mentioned in the comments there by the end of the day. And it looks like we don't have any more questions. So Josh, thank you so much for doing this.
I really appreciate the opportunity, and I really want to just, in closing, thank the business community for working through this process as we've had this global pandemic with such a rapid spread, and some of the unknowns that have been in front of us, and looking at reasoning why we had to move forward with stay-at-home orders in restricting, hopefully, and mitigating transmission. I think what we have not seen been a stressor on the hospital is a testament to everybody working hard to bear the brunt of these orders. And I just, want to put that out there, that we are not insensitive to the situation that this pandemic has created. But I do know that what we've seen so far with our being able to keep it out of our long-term care facilities has been a huge priority for us at Garfield County, because we have at least 10 long-term care assisted facilities in the county. And for a county our size, that's a huge long-term care population. Most counties our size maybe have one. As far as our size of population, Eagle, I think, maybe has one, Pickens 0 that I know of. And so that's been a huge focus. We've been able to do that so far. I can't say that's going to be, we're going to be able to do that forever, because it is such a vulnerable population, but as well as keeping the surge from the hospital and flattening that curve for us. I think that's what we've seen these policies work, and now we're going to strive hard to get these phased open approach businesses back open as much as possible. I do want to say, though, it may be a start and stop type scenario, to where what we're looking to do with these phases is open up restrictions a little bit. Part of that is to then watch what is the disease response in the community. So that's why you see those couple weeks in there in that time frame. That gives us the ability to analyze, looking at how the incubation period of the disease works, and then what the potential effects are on the medical community. And then if everything looks good leading up to this next phase, and then we'll open up a little bit more. And so that's kind of part of that theory behind what you're seeing with some of these dates. But I really appreciate the opportunity.
Thanks again, Josh. And if you have any suggestions for future business and breakfasts, or you have any questions, feel free to shoot me an email at larnold@gcpld.org. And thanks again, Josh, and everyone. I hope you have a good rest of your day.
Thank you very much.